Well, we are the men and women for others. We're a small group of undergraduate students who offer time every week. We work in the hospital in the emergency department. We're a pretty diverse group. We come from all sorts of different backgrounds. We're studying different things. The way we serve others is in the hospital. We use the skills that we've learned through our training. Every member of SBIRT is a trained EMT, coupled with the education we've received from our Boston College courses. And we tie that in with whatever personal experiences we have to effectively screen any patient or anyone seeking help who comes in the emergency department.
Well, at Boston College, there are a lot of volunteer organizations, and SBIRT is no different. And it's completely student-run, and it's completely volunteer-based organization. And at the heart of volunteering is this idea of selflessness.
When we go to the hospital, most of the patients that we do screen happen to be BC students. This means that these students that come in for alcohol use and substance use problems generally are confused about their whereabouts. They're generally nervous, anxious, concerned about consequences at Boston College. So it's honestly a great program in that we walk in, we have a connection immediately. I'm a student at Boston College, and there is that immediate sight and feeling of relief that the students have because they know that there's someone there to answer their questions and to kind of help them out while they're in that difficult situation.
St. Elizabeth's Medical Center and Boston College Collaborative is very unique because it's peer-to-peer based, first of all, and it is volunteer and 100% unfunded. I'll speak to the unfunded part first. We're very cost effective in that we require no expenditures by the institutions that run us. Peer-to-peer, it's very easy for a college student to relate to another college student. And even if we're not relating to a college student, let's say we're relating to a community member, it's much easier for someone who's not in a position of authority to relate to them than someone like a doctor or nurse who they may feel intimidated by. To give an example of this, one of the most common questions I get asked in the beginning of the screen is, do you know what hospital I'm in? Clearly the doctors and nurses know the answer to this. They all know they're at St. Elizabeth's. However, why hasn't the patient asked them? I think the reason this is because they didn't feel comfortable asking them questions. They just felt like all they were there to do was to receive treatment and be asked questions of them. We really give them a chance to have the patient express themselves and ask questions of their own.
SBIRT is unlike any other thing I've experienced in my life, and I've done thousands of hours of volunteering with other organizations. And the reason is because SBIRT, as a screener in the ER, you are kind of in between a professional doctor and a family member. You're kind of in the space in between. So whereas a patient who is suffering from substance abuse or at risk for substance abuse, they may be very limited in what they say to a physician maybe because of judgment, professional judgment, or their own family member because, again, it's personal. There may be a shame involved with that.
A lot of the students that I've spoken with have gone through academic stresses or social anxieties, especially freshmen, just being introduced to a whole new group of people and deciding which group of friends is their real group of friends and who to hang out with, and also just balancing home life with school life and how to talk to their parents or family members better. And those are all things that I've gone through personally, or I was going through at the same time that I was speaking to another patient. So I felt like I was able to relate a lot more.
I think there are three things that make SBIRT unique. One is its volunteer basis. Another is it's the fact that it captures the teachable moment in a patient's experience. And the third is that it follows trends in preventative care and healthcare. So oftentimes we see that a patient may be very nervous when talking to a physician because perhaps they're, when the physician is taking a history, the patient only has a set amount of time to tell them everything they want or all the major issues that they need to deal with. And the special thing about being a volunteer service is that we have the time to talk to patients. When we see a patient on the hospital bed, we find them in a teachable moment. And This teachable moment is important in two ways, in that the patient is in a low point in their life, and also that the patient is in a state of self-reflection, that they are very willing and open to change some aspects of their life in this state. And by doing this, we have a more holistic view of how the patient's life works. And by connecting these issues to one another, we can really formulate a plan that will help them after their stay in the ER, that we're caring not only for their immediate needs, but for the long-term needs.
Well, one of the biggest factors that you pick up on screening patients in the ER is that there's a very big need to pay attention to people's feelings, what they're actually saying, their body movement, what they exude outside of just their verbal communication. And that's something you pick up on very quickly just from working with patient interaction. You learn how to listen very intently to what people are saying and reflect it back to them in a positive manner.
Screening patients kind of is a unique opportunity to hone your communication skills. It allows you to identify different modulations of like inflection, tone, that is really important in the delicate nature of work with mental health and substance use.
As far as sensitivity towards patients go, I've found that really anyone who comes into the emergency department, I mean, they need something, but different patients need different things. And like, for example, I mean, some patients come in and they'll just need education. And that's something that I'm definitely well trained to help them with. I mean, I can offer tangible strategies for, whether it be refusing a drink or just how to socially use alcohol in a safe way and make sure that patients don't end up in the hospital again. Some patients need motivation, and that's really something that a screener can't provide, but it's something that they can help tease out of the patient themselves by working with them and by talking with them and by reading in between the lines and trying to figure out what the patient's goals are, what they want to get out of their undergraduate experience if they're a student or if they're not, just maybe what they want to get out of life as a whole.
When I first started SBIRT as a freshman, I was really like amazed by how much like patient interaction that you're getting. But after a while, I felt that it kind of like not died down, but it kind of like lessened, and then until like I started realizing that that's not what SBIRT is really about. Yes, it is about speaking with patients. It is about like speaking with them and taught like the SBIRT protocol, but it is also about what else you could do for the SBIRT like group, what other specializations you could get into, kind of like seeking your interest in the program. And I think that made the program so special because you could do whatever you want, and also like quality improvement I found was very important.
The SBIRT Collaborative really focuses on basically bettering patient outcome. So there's a lot of measures in place. The clinical case review we do every 2 weeks to make sure that basically all of our patients are treated as well as possible.
Every other week we do clinical case reviews, and that's really important I think for me because I get to hear other screeners talk about their encounters, and I feel like I'm still learning so much from just what they say and being allowed to ask them questions and critique them.
In terms of numbers, you put in about 4 hours on the weekends, and every other weekend there's a 2-hour roundtable meeting. But because it's a student-run organization, their time with SBIRT really extends outside of those, those time frames. So whatever needs to be done, there's a student doing it.
It is right during your Friday night, Saturday night, and then really early Saturday morning, Sunday morning. I'm not an early person, but I'd say that that's really the only way it could be properly implemented. Part of the entire methodology of SBIRT is that we speak to the patients who really are using at-risk substances, and so that obviously occurs mostly Friday and Saturday night. And one very fortunate aspect of that is that for the most part, everyone's fairly free at that time in terms of we don't have academics at that time, even if it's annoying to have to say, you know, you can't do this, you can't do that. In terms of your social responsibilities, at least you're able to go and not forfeit your academics.
Certainly as an undergraduate in classes and whatnot, it's difficult waking up at 6 to 10 a.m. and going to work at 6 to 10 p.m., but I think with the unique opportunity that it's a good chance to benefit the BC community, and I think it's definitely beneficial for me on the whole. As far as the timing in my academic career, I don't think it could have come at any better time. As a freshman, starting out at BC and getting a kind of undergraduate experience, that's really key to me before moving on to a career in healthcare.
SBIRT really gave me an opportunity to gain much more patient contact and really kind of change the way I looked at healthcare. It gave me a huge ability to interact with doctors. Never before would I think I would, as an undergraduate, be able to interact with doctors, consult with doctors and nurses before I go into a patient's room, talk to them afterwards about what the patient, how the patient feels their treatment's going, where the patient feels their treatment needs to go. And also, as an EMT, I was able to get patient contact, but not this same level of patient contact. This patient contact, you're really creating rapport with the patient. You're getting to know them, they're getting to know a little bit about you, and you're really allowing them to open up to you. And I really think that this ability to build this rapport will work well with bedside manner as I go on, hopefully, to medical school.
Professionally, the SBIRT Collaborative has definitely opened my eyes to the avenue of preventative health. And now, when I'm looking at medical schools, I have a special eye out for those that offer a joint program in Masters in Public Health. So that's something I'm totally open to, and nothing's set in stone yet, but I'm really happy I took this opportunity, and it's opened my eyes to different paths.
Well, I found SBIRT at a very unique time in my undergraduate career. I was a sophomore when I found the program. And I was definitely working to hone certain skills, mainly the patient interaction skills. And I also had very clear interests in, serving humanity. I had a minor in faith, peace, and justice, which I was just starting into, and I had very clear interests in science. And I was hoping one day to kind of blend these two interests into working as a physician.
I've taken a lot out of the SBIRT program. It's trained me in a lot of the clinical setting and how to interact with nurses, with patients, all that kind of stuff. But it's more than that. You get a lot of, you get to think about a lot of philosophical ideas that you might not necessarily consider when you see someone who's been homeless for 30 years and has been depressed for the last who knows how long.
The SBIRT program has helped me picture like the healthcare environment at the hospital, and also the fact that alcohol use, substance use, and abuse is really an epidemic in our society, and oftentimes people see that it's not really a problem, it's just the patient's fault for not controlling themselves, but in fact it really is a disease, and that patients require the need to get appropriate treatment for it. I think a lot of patients are misunderstood, and they really do deserve the appropriate treatment like everyone else with any other disease.
I think before this experience, if I heard that someone was sent to the hospital for, for alcohol or drug problems, there's like some things I'd think about them. You'd probably assume the worst. You'd probably assume that it's just like their choice that they're making. But through the SBIRT program, you can see that these people, they're just like you and me, and a lot of them have been put through really hard circumstances. And usually the reason why they do the things they do isn't because they're a bad person or necessarily that they're choosing to do this, but a lot of times it's either a cry for help or it's just, it's something small that it's been working at them or something big that no one else sees. And so I guess it's sort of made me take a second and think before I judge people too quickly.